முடிச்சிரு இன்னும் 15 minutes. In our yesterday class, we had discussed about certain conditions with associated with the extras. What do you mean by those extras? Extras are nothing but your bones, which includes your ribs, your vertebra, your scapula, clavicle, as well as humerus. In yesterday class, we had discussed about rib fractures, subcutaneous emphysema, rickets, part spine, and also osteopetrosis. These are all the things we saw yesterday. Now today let's discuss about some of the other things. As we described already, your chest X-ray will comprise two compartments. One is your black colored thing, that is your lung, and white colored things, which are nothing your ribs, bones, soft tissue, as well as your heart. What will happen when there is replacement of alveolar fluid by something else? You all know that the lungs are black in color because your alveoli contains air. If alveoli is replaced by some other things, you will get opaque thorax or heterogeneous opacities involving lung fields rather than appearing translucency. So opaque thorax is basically, opaque means what? White out lung. I repeat, opaque means what? White out lung. Whenever you get this opaque hemithorax, you need to see whether the mediastinum is pulled or pushed. If the mediastinum is pulled, means it is collapsed. That is, your alveoli air is replaced by nothing else, as a result of which alveoli will get compressed. So when all air is replaced by nothing, means the lung volume will become shrunken, and you will get white out hemithorax, either involving all lobes or some particular lobes, leading to mediastinal shift. Your trachea will be shifted to the same side. I repeat, your trachea will be shifted to the same side. Second, when your mediastinum is pushed to opposite side, when your mediastinum is pushed to opposite side, it means that there is pleural effusion on that side, the side with pushed, pleural effusion. The third one is mediastinum is central, neither pulled nor pushed, means it is a case of consolidation. That is, your alveolar air is replaced by pus. That is called as consolidation. This is with respect to theory, but look at the practical things. What is A? In A, you have, look at this, trachea is shifted to the same side where opaque hemithorax is there. Look at this, the entire lung undergoes opacity because all alveolar air went out, leading to collapse of lung. As a result of which, the heart is pushed to the right side. The trachea is pushed to the right side. When trachea alone is pulled to the same side, it means upper lobe collapse. When mediastinum heart is pulled to the side of opacity, then it is called as collapse involving the lower lobe, right? Remember, in a normal X-ray, 1/3 of heart is on the right side and 2/3 of the heart is on the left side. When your trachea is pulled to the same side, it means collapse involving upper lobe. When mediastinum is pulled to the side of opacity, then it means that collapse involving the lower lobe, right? Here both trachea as well as your mediastinum is pulled to the same side, then it is called as collapse involving both upper and lower lobe. Collapse involving both upper and lower lobe. This one, the one on the this side, this X-ray. Then look at this, the second X-ray. What happens in the second X-ray? The second X-ray is characterized by, so your trachea is in the straight line, neither pulled nor pushed. Trachea is in the straight line. One third of the heart is on the right side of the vertebral column. Another two-thirds of the heart is on the left side of the vertebral column. So what does it mean? Neither pulled nor pushed, both upper and lower lobe. And you have a heterogeneous opacity involving the right upper lobe. So what is the diagnosis? Whenever there is heterogeneous opacity involving one lobe, and when your trachea as well as mediastinum is neither pulled nor pushed, means it is a case of consolidation. What is this? This is a case of consolidation. Whereas whenever there is heterogeneous opacity along pulling to the same side, means it is called collapse. It is called as what? Collapse. So this is collapse and this is consolidation. Collapse, pulled to the same side. Consolidation, central, no pull or no push. Now look at this, the third X-ray. And what happens here? The volume on the right side is little bit low, and instead of one third of the heart on the left side, two-thirds of the heart is on the right side and only one third on the left side, and there is heterogeneous opacity involving the entire left hemithorax. So what happens here? Heterogeneous opacity involving the entire left hemithorax, and your mediastinum is pushed to the opposite side. When mediastinum is pushed to the opposite side, then it is called as pleural effusion. That is fluid present in the pleural cavity. This is called as pleural effusion. Heterogeneous opacity, mediastinum trachea to the same side, collapse. Mediastinum shifted to opposite side, pleural effusion. Mediastinum neither pulled nor pushed, central, means consolidation. These are all the three common whiteout things in our day-to-day practice in X-ray chest. So collapse, consolidation, and this is pleural effusion. What is this? I told you, you need to compare both right and left lung volume. Look at this, right lung volume is okay, left lung volume is also okay. This is your heart, relatively normal. But there is a whiteout opacity. There is whiteout opacity in the right paratracheal region. There is whiteout opacity in the right paratracheal region. Particularly when this is an infant or a small young child, particularly less than 4 years, this whiteout opaque structure which doesn't cause any harm to the underlying lung, means this is a case of thymus. So look here, a young child, if you get a relatively opaque right paratracheal or left paratracheal region opacity, along with that some other features. What is this? This is called Sale sign. So what is this? This is called Sale sign. Look at this. It just looking like a sail. It just looking like a sail of a boat. This is called sail sign. Apart from that, you will have lobular margins. What? You will have lobular margins. So thymus means you will get sail sign. Other things are wave sign. Other things are wave sign, lobular margin, and the border of the thymus as well as the heart has got as an incisura. This space, triangular space between thymus and associated heart is called as incisura. Thymus usually occupies the superior mediastinum, but sometimes, particularly in children between 4 to 5 years of age, we often have a confusion whether it is thymus or all hilar adenopathy. In those cases, you need to look for ultrasound neck. In ultrasound neck, you will have a starry sky pattern. Whereas in case of node, you don't have any starry sky pattern. So young infants, right paratracheal, left paratracheal with lobular margins or wavy margins, sail sign and incisura between the place where your thymus and heart meets. These three findings are suggestive of thymus. It will not produce any structural displacement of your trachea. So trachea will be in a straight line. And when you have doubt, you need to go for an ultrasound chest, and presence of wavy margin, the presence of starry sky pattern indicates that it is a case of thymus. But here, this is a 10-year-old boy with fever, cough, and breathing difficulty. This is a 10-year-old boy with the breathing, cough, breathing, and difficulty in breathing for more than 2 weeks. Here, the trachea is in the straight line. But look here, there is a convex outward, and this is a 10-year-old boy. For a 10-year-old boy, you don't have any thymus opacities in the X-rays. Thymus usually seen only in children less than 2 years, at least a maximum of 5 years. You will not see thymus in children more than 5 years. And when you have this kind of opacities around the paratracheal region, and you have this opacity margin convex out, I repeat, convex out means this is a case of hilar adenopathy, and it can be either a lymphoma or a case of tuberculosis. This is a case of mediastinal adenopathy. What is this? This is a 6-year-old boy with fever of more than 2 weeks, cough for more than 2 weeks, along with weight loss of more than 2 kilograms. Along with weight loss of more than 2 kilograms. And look at this. Whenever any child in India comes with fever of more than 2 weeks and cough for more than 2 weeks, invariably in India, you need to think in terms of a tuberculosis. But what is this pattern called as? You could see numerous structures symmetrically over the entire upper and lower lobe, and this structures presenting over the entire right and left thorax is called as miliary pattern. What is this called as? Miliary pattern. This nodular shadows of 1 to 2 millimeter occupying all three zones is suggestive of miliary pattern. Otherwise, it is suggestive of tuberculosis. What is this? A 4-year-old male with hypoxia. In this X-ray, you saw numerous small dot things, only dot pattern. Whereas in this, apart from dot, you will get numerous commas. So here you have a combination of dots and commas, otherwise known as dots and commas. So dots and commas, white things. Okay, dots are nothing but nodular, commas are nothing but reticular. This widespread bilateral dot and nodular pattern, dots and comma pattern, are otherwise known as reticulonodular pattern, is suggestive of interstitial lung disease, and the investigation of choice for any interstitial lung disease is your HRCT. Whereas in case of X-ray, you need to look for dots and commas pattern. Okay, here what is this? Look at this. What is this? Again, a heterogeneous opacity involving your right upper lobe. What is that? Your heterogeneous opacity involving your right upper lobe, and there are numerous cystic spaces. I repeat, there are numerous cystic spaces in between. So what is this? This is dilatation of the bronchus, otherwise known as cystic bronchiectasis. Otherwise known as cystic bronchiectasis. Whenever you will get bronchiectasis involving the upper lobe, whether it is right or left, It is suggestive of cystic fibrosis in our country. I repeat, any bronchiectasis involving your right upper lobe or left upper lobe can be either cystic bronchiectasis or it is due to cystic fibrosis. Upper lobe bronchiectasis is due to cystic fibrosis. Rarely it can be due to sequelae of TB bronchiectasis. Right. Then comes to black lung or otherwise known as hyperlucent lung. Look at this. What is this? Lucent lung, single lung. Lucent lung. Look at this. The volume of the right lung is more compared to the volume of the left lung. And also the right lung is more lucent or black compared to left lung. Whenever you get this kind of lucent increased volume of one particular lung, this is called as obstructive emphysema pattern. What is this pattern called as? Obstructive emphysema pattern. In pediatrics, obstructive emphysema pattern is characterized by, in pediatrics, obstructive emphysema is characterized by foreign body unless otherwise proved, involving your right main bronchus. Whenever you are hyperlucent lung on the right side with increased volume and aeration, it is called, it is foreign body in the right main bronchus. If it involves the left lung, then it is called foreign body left main bronchus. And look at this. In this lung, the both lungs are hyperlucent. Both lungs are hyperlucent and the volume of the lung is much and there is flattening of the diaphragm. This bilateral hyperlucency is called as bilateral hyperinflation. It indicates that a foreign body could be in the trachea or it can be a case of asthma. It can also be present in acidotic breathing or Kussmaul breathing. Look at this. In this, there is hyperlucency involving one lobe, but here the underlying lung is collapsed and you could not see any pulmonary vascular markings. When you don't see pulmonary vascular markings along with collapsed lung, it indicates that it is a case of pneumothorax. I repeat, pneumothorax is characterized by increased translucency of one lung with underlying collapse, along with that absence of pulmonary vascular markings over that black area. That is pneumothorax. Okay, right. And look at this. In this X-ray, there are cystic spaces. Look at this, cystic spaces involving one lobe, right upper lobe. Along with that, there is compression involving the right lower lobe. So this cystic space in a child causing collapse of underlying remaining lung. This is called as CAM, cystic adenomatoid malformation. And finally, what is this? Here you have an hyperlucent lung involving the left upper lobe and the mediastinum is shifted to the opposite side and particularly air entry is reduced. You need to consider as a case of congenital lobar emphysema. Whenever it produces respiratory distress, it has to be removed. And finally, you will see air under the diaphragm, not air under the diaphragm, air between the diaphragm and the heart, as well as air unusually present here. Whenever you get unusual presence of air, either between the heart and the diaphragm or paracardiac lucency, it is called pneumomediastinum. What is that called as? Pneumomediastinum. Right? So with this, we have discussed about some lucent lung, some radio opaque lung. And tomorrow in Shushruta batch, we will be discussing X-ray chest in detail for about an hour. Thank you.